Border points have become hotspots in the spread of COVID-19. Crowding, minimal practice of social distancing coupled with lack of the needed wash facilities are the main challenges. Water, sanitation and hygiene interventions at border points requires urgent attention in the fight against the ongoing coronavirus outbreak and other communicable diseases. In this light, WaterAid East Africa, an international non-governmental organization, partnered with East African Community, EAC, and country government structures to minimize the spread of communicable diseases including COVID-19 infections and protect at-risk communities. This has been done through a region-wide inclusive wash intervention cutting across 5 borders, reaching a total of 6 East African countries. WaterAid's vision is a world where everyone has access to clean water, hygiene and sanitation.
Each of the countries, there have been a lot of work around developing and building and designing very friendly hand washing facilities that can be used not just for men and women but those living with disabilities across the countries where we have presence. We saw that infections were increasing in countries across the region and we were wondering what is causing this. So we then started to do some analysis and some research, and we discovered that those truck drivers that move food and other goods and services appear to be the ones that are most infected by COVID because they do not have any way to protect themselves. And so when we did the research, we saw it was cutting across the entire region. And then we started to talk to our partners. Kewasnet is one of them, Kenya. We talked to Tawaznet. Tawaznet is in Tanzania. Uwaznet, Uganda, and of course here we have WaterAid Rwanda itself.
In Kenya, WaterAid East Africa partnered with the Kenya Water and Sanitation Civil Society Network, Kewasnet, to improve hygiene services through installation of modern hand-washing facilities at Busia and Malaba border points.
Why did we set up in Busia? Busia is one of the highest traffic in all other border points. See, this facility serves both Uganda and Kenya.
We did the implementation bit of putting up the structure, but we have been funded by WaterAid East Africa. Maybe if you look like at the roof, we made it to be a bit translucent. This is simply because we don't want to provide a lot of shade here so that people just come, they do hand washing, and then they move. We also have the stances, the smaller ones which can be used by children and maybe people that have maybe some disabilities or they're disabled, because these ones are a bit lower. So somebody with a wheelchair can go in there and use the facility quite comfortably. Healthy people trade better. And so that's the main thing, that we keep people healthy and that they continue working, we improve our economy. That's the outlook.
And for truck drivers, these facilities could not have come at a better time.
Mbele ya mradi huu, yani tunakuwa tuna sanitizer, pengine unakuja sanitizer unasahau kwenye gari, tena unaenda kwenye gari lakini maji iko hapa, mtu anaoga mkono, basi inakuwa sawa.
Kulingana na vile naona mpangilio hapa ya kuoga mkono, naona iko mzuri sababu mahali ya kumbobya maji ubobi na mkono, unatumia mguu. Sabuni iko, maji iko kwa wingi. Kitambo haikuwa mzuri sababu unaenda unapata unajifungulia tabu, unashika na ile mkono. Mwingine anakuja anafungua na ile mkono bado. Ilikuwa at least sio mzuri sana.
At Holili border point, which is a crossing between Kenya and Tanzania, WaterAid has constructed hand washing facilities.
Tumefanya hivi kwa nia tu ya kusaidia sana katika kupunguza maambukizi ambayo yanaweza kuzuiliwa kwa kunawa mikono.
Na wizara yetu kama serikali kwa jumla iko mstari wa mbele katika kukinga wananchi wake dhidi ya maradhi.
At the Vurra border, connecting Uganda and DRC, an average of 100 trucks cross the border between the two countries daily. At this border point, WaterAid East Africa, in partnership with Uganda Water and Sanitation Network, UWASNET, has constructed contactless hand washing with soap facilities.
In the wake of the pandemic, WHO declared that hygiene guidelines to minimize the spread of COVID-19. So among these is the hand washing practice, proper hygiene and sanitation across the border points in addition to testing of truck drivers. And I believe this border point sees quite a bit of truck drivers that go through. So without a doubt, the borders within East Africa region play an important role amidst the pandemic, and border routes have been essential for the cross-border trade. On the other hand, they've also been among the causes of transmitting the coronavirus. Aligned to WaterAid's strategic focus is the need to be able to leverage existing work, experience and expand the opportunities in new countries to get closer to the realization of SDG 6, which is clean water and sanitation. And that is why we're here today.
Now, moving to the land of 1,000 hills, welcome to Nemba border, a link between two neighboring countries, Rwanda and Burundi. At this border point, the joint and collaborative efforts of WaterAid and the government of Rwanda through Bugesera district and Nemba border are improving the hygiene and sanitation facilities at the border. This is allowing the border to cater to the increasing number of people moving across the borders, including Burundians who are returning home using the border.
We got WaterAid. It does not mean that we considered WaterAid only. There were so many others, but the standards, the requirements, the characteristics of the type of intervention that we wanted to do, we found them from WaterAid. We needed to make sure that at least within 3 months we achieved something. And indeed, WaterAid demonstrated that they can really achieve.
Globally, 1 in 10 people don't have clean water close to their home. These are facts. 1 in 4 people don't have a decent toilet that they own. And 2 in 5 households globally don't have adequate hand washing facilities. So if you have those services and facilities in your homes, don't take it for granted.
This region-wide wash intervention adheres to WaterAid's quality program standards through joint implementation and monitoring.
We saw that our budgets really covered one side. And if you're truly going to make a difference, you need to do the other side as well. So that one was one of the things we highlighted, and we also discussed with ESC. So what we are planning to do in this financial year is to see how we can ring fence, working closely with them and also raising additional funds. The second one is that we didn't feel that we did enough around the hygiene behavior change messaging. So that's another layer that we feel we need to put on the ground as we do that.
So you see, this is a very good project that will benefit many Rwandans who use this space every day. And I want to make a plea to our partners, especially WaterAid, to make sure that we make much more of these kind of projects.
Water, sanitation and hygiene, WASH, have been highlighted as preventive measures in containing the spread. Beyond the pandemic, these border points will continue to be essential in the fight against other communicable diseases.
I just have to say a big, huge thank you and commitment that we saw from all our key implementing partners. That for me was a huge one, because despite all the odds, they were able to still push ahead, even in their own spaces, to make advocacy to government around, something, we need to put more funds here. Because for the EAC, places where our footprints of WaterAid will not reach, is to continue to encourage and support them, to see the extent where they can actually extend all of this work that has been done to those other borders. I think now is the time for government to now recognize that we need to strengthen our health systems, whether we like it or not. Pandemics have come to stay with us. It is how we manage them that matter.